Good afternoon, all of you. My name is Khushboo Gupta, and I am Associate Professor in IIMT College of Pharmacy, Greater Noida. My topic for presentation is hypertension. What is hypertension? Hypertension is the increase in blood pressure in the walls of heart. You all may also be aware about this condition. In this condition, the blood pressure in the arteries is elevated, or it is also known as high blood pressure, which is up to 140 by 90 mm of Hg. It may also increase up to beyond that. We'll discuss these conditions later on. It is the most common cardiovascular disease, or it may become serious if it is not treated properly. This is also known as silent killer. Why it is known as silent killer? Because sometimes the persons with high blood pressure are not feeling any symptoms, due to which it will kill them silently, and it is also known as silent killer. So the only way to get rid of this is regular checkup. If we'll do the regular checkup, then only we'll came to know about the conditions of our heart, whether they are normal or not normal, or there are some changes in the blood pressure of our heart. Then we can cure it according to the prescription of doctor and according to the condition. So the only way to get rid of this condition is regular checkup. Now, the types of hypertension. In the types of hypertension are majorly it is of two types. First is primary hypertension and second is secondary hypertension. Primary hypertension is also known as essential hypertension. The major difference between the primary and the secondary hypertension is the cause of primary hypertension is not known, but the cause of secondary hypertension is known. It is, as I have discussed, the primary hypertension is also known as essential hypertension. Some causes of this type of hypertension are due to genetics, due to the changes in diet, due to lifestyle modification, and according to the age of some individuals. Some of these lifestyle modifications, or we can say the lifestyle disorders, include excessive smoking, drinking alcohol, increase in weight, stress, intake of too much salt, and lack of exercise. Due to this, several physicians have suggested that the changes in our diet and lifestyle modification can decrease the blood pressure and risk of hypertension related complications. So if we'll do some changes in our diet, or we'll do regular exercise, decrease the intake of salt in our diet, we can surely overcome with this type of hypertension. Now the second is secondary hypertension, and the cause of secondary hypertension is known and it is reversible. Approximately 5 to 10% of individuals suffer from this type of hypertension, and it is most commonly seen in young individuals, in the people between the age of 18 to 40 years. Major causes of this hypertension are abnormality in the supply of blood to the kidneys due to narrowing of arteries. What happens in this? In the arteries of heart, there is a decrease in the supply of blood, due to which in the kidneys an enzyme is activated which is known as renin, and which results in the narrowing of arteries. And due to this narrowing of arteries, there is vasoconstriction, which results in increase in blood pressure. Second is obstruction of airways during sleep. During sleep, the airways, or we can say that lungs, are obstructed, due to which it will affect the pulmonary circulation in the heart, and it may also lead to vasoconstriction, which will lead to hypertension or increase in blood pressure. Second is adrenal gland tumors. Next is hormonal abnormalities, some abnormalities in thyroid gland, And the last is due to the side effect of various type of medications such as birth control pills, CNS stimulant, CNS depressant, over-the-counter drug, and several others. So if the cause of this type hypertension is diagnosed, then we can easily cure it. Other additional types are, first is isolated systolic hypertension, where the blood pressure recording is done in majorly two ways. First is systolic blood pressure and second is diastolic blood pressure. In systolic blood pressure is the pressure which is exerted on the walls of. Next is isolated systolic hypertension. And as I have told you that these are of two types, systolic and diastolic blood pressure. Systolic blood pressure is the pressure which is exerted on the walls of heart during contraction. And diastolic blood pressure is the pressure which is exerted on the walls of heart during relaxation. So in isolated systolic hypertension, what happens? The blood pressure rises above 140. And which blood pressure? The systolic blood pressure rises above 140, whereas the diastolic blood pressure remains constant. Which means that the diastolic blood pressure is not affected in this condition. Only the systolic blood pressure is increased up to 140. And it is most commonly seen in the individuals which are over the age of 65. Why? What is the reason behind it? The reason behind this is the loss of elasticity in the arteries of their heart. The elasticity is lost in the arteries of their heart, due to which the systolic blood pressure is increased in the older age individual. And therefore, the major determining factor for this is the systolic blood pressure as compared to diastolic blood pressure. Now, the next is resistant hypertension. Resistant hypertension is defined as the blood pressure which is very difficult to control and it requires various types of medication. Approximately 10% of individuals with high blood pressure develops this type of hypertension. People with this type of hypertension can be treated with the help of multiple drug therapy. The persons with this type of hypertension requires multiple drug therapy. Next is malignant hypertension, which is defined as the high blood pressure which causes damage to our internal organs, and it is also known as emergency condition. In this type, the blood pressure rises to more than 180/30. That means the major difference between resistant hypertension and malignant hypertension is there is high blood pressure in resistant hypertension, but in malignant hypertension, the blood pressure is increased more than 180/30. And it is a very severe condition. It may also lead to multiple organ failure. So this is controlled not only with the help of multiple drug therapy, but all the conditions which are responsible for hypertension. So the next is the risk factors for the hypertension. First and foremost factor is obesity, which should be controlled by following proper diet and exercise. Second is age, as the people after 50 years of age are usually develop coronary artery disease. Coronary artery disease is the disease in which the blood flow to the walls of heart is reduced, which will lead to the vasoconstriction and it will lead to a decrease in blood pressure. Next is diabetes. Diabetes is another major determining factor. How diabetes is related to hypertension? Diabetes, in the diabetes, when it is not controlled or it is beyond the limit, beyond the normal limit, then it will lead to the secondary complications by affecting other organs of our body. And these organs are the heart and the kidney. The major organs which are affected first are the heart and kidney. So in the heart, it will lead to the vasoconstriction and increase in blood pressure. Smoking and drinking alcohol is another factor. Some family history is there, then it may also lead to hypertension. Lifestyle modification may also lead to hypertension, and the stress is also another determining factor. Next is pathophysiology of hypertension. In this, the blood pressure is maintained by four major mechanisms. First is activity of sympathetic nervous system, renal system activity, through vascular endothelium, and endocrine system activity. So the first factor, which is activity of sympathetic nervous system, is determined by, due to the decrease in the blood pressure, there is an increase in the activation of sympathetic nervous system. Whenever there is a signal in our body that the blood pressure is decreasing, our sympathetic nervous system will activate. Now, there are two mechanisms behind this: increase in activity of sympathetic nervous system and decrease in activity of sympathetic nervous system. When there is an increase in activity of sympathetic nervous system, there is increase in the heart rate and cardiac contraction. Due to this cardiac contraction, what happens? Vasoconstriction occurs, and vasoconstriction will ultimately result in the release of an enzyme which is known as renin, and this enzyme is released from the kidney. I will show you in the next slide how this renin enzyme is responsible for the controlling of blood pressure. This renin enzyme will activate renin-angiotensin aldosterone system, which will result in decreasing the blood pressure. So the net effect is by increasing the cardiac output and vascular resistance. Second is, due to the decrease in the activity of sympathetic nervous system, there is a decrease in the activity of vasomotor nerve fibers. These nerve fibers are the part of our CNS. The signal is transmitted through sympathetic nervous system, which will result in the relaxation of vascular smooth muscles of heart. There is an increase in the diameter of arteries, which will finally result in lowering of blood pressure. Next is through vascular endothelium. What is vascular endothelium? It is the inside layer, single cell layer, which lines the blood vessels of our heart. In this, there is a release of nitric oxide and other vasoactive substances. What are these vasoactive substances? These are the substances which activate the blood vessels of our heart. These vasoactive substances are endothelin. These are released through the vascular endothelium layer of our heart. These substances will then result in the lowering of, in the increase in the blood pressure due to the vasoconstriction. Now, as I have told you earlier, how this renal system activity is related, as you all can see in this chart, angiotensinogen is converted to angiotensin 1 in the presence of enzyme renin, and renin is released due to the activation of sympathetic nervous system. So when this angiotensin 1 is converted to angiotensin 2 in the presence of enzyme angiotensin converting inhibitors. So majorly renin and angiotensin converting enzyme inhibitor is responsible for the hypertension. How? They will act at angiotensin 1 and angiotensin 2 enzyme. These will then decrease the renal vascular resistance, medullary blood flow, and increase in the activity of aldosterone, due to which the interstitial pressure is decreased and reabsorption of sodium is increased, which will ultimately result in increase in blood pressure, or we can say hypertension. Now the last one is endocrine system activity. In this, there is a stimulation of angiotensin 2 in the adrenal cortex, which will result in the secretion of aldosterone. This aldosterone will result in the stimulation of kidneys. Now, when this aldosterone will result in the stimulation of kidneys, there is a retention of sodium and water. Sodium and water will reabsorb, which will result in the increase in blood pressure and cardiac output, because it will lead to the vasoconstriction, and due to which the blood pressure is increased. So how can we manage this hypertension? The management of hypertension is done in two ways. First is lifestyle modification and second is pharmacological therapy. In lifestyle modification, we can reduce the weight, reduce the amount of sodium in our diet. We can adopt the various resources of diet to reduce the hypertension. Through routine exercise, we can also reduce the hypertension and management of stress. So basically, we will emphasize on a proper modified diet, and will maintain the proper weight and do the routine or daily exercise. We can easily manage the hypertension, or I can say that we can at least manage to come to the later stage of hypertension. We can be at the earlier stages of hypertension if we'll go with the lifestyle modification. Second is pharmacological drugs. Several types of drugs are used for the treatment of hypertension. These drugs are also known as antihypertensive drugs. The first class is diuretics. Diuretics are the drugs which increases the formation of urine. But here, these drugs inhibit the reabsorption of sodium. As I told you earlier, there is an increase in the reabsorption of sodium in the arteries, which will lead to the vasoconstriction and increase in blood pressure. So what will diuretics do? These diuretics will inhibit this reabsorption of sodium in the distal convoluted tubule and ascending limb of loop of Henle. These are the parts of nephron, due to which it will result in vasodilation and it will decrease the blood pressure. The drugs for this are chlorothiazide, furosemide, and bumetanide. Next class is beta blockers. These drugs act by blocking the beta adrenergic receptors in the sympathetic nervous system. The beta adrenergic receptors are blocked. It will decrease the heart rate by reducing the sympathetic activity. It will cause the vasoconstriction and reduces the sympathetic activity. Okay. There is a decrease in the vasoconstriction and sympathetic activity, due to which vasodilation will occur and the blood pressure is decreased again. Example for these drugs are metoprolol and propranolol. Next is angiotensin converting enzyme inhibitors. These drugs act by preventing the conversion of angiotensin 1 to angiotensin 2. So, this will ultimately prevent the vasoconstriction. I will show you again this chart. How these drugs will act. They will inhibit this enzyme, angiotensin converting enzyme. So, there is no formation of angiotensin 2. If there is no formation of angiotensin 2, this pathway will not be activated. There is no reabsorption of sodium, no increase in interstitial pressure, no renal vascular resistance, no decrease in blood flow, and ultimately there is no hypertension. If angiotensin 2 is not converted, so there is vasodilation. It will prevent the vasoconstriction and it will lead to the reduction in blood pressure. Example for this class are captopril and enalapril. And the last class is calcium channel blockers. These drugs are not first line drugs for the treatment of hypertension. These are second line drugs which are most of the time prescribed by the doctors as a combination therapy for the management of hypertension. These drugs act by blocking the entry of calcium. What does calcium do in our body? It causes the contraction of blood vessels. So, if there is no entry of calcium in our body, what will happen? There is dilation in the blood vessel. Always calcium cause contraction. So, if we block this entry of calcium, what will happen? Vasodilation will occur in the arteries of heart, which will lead to the decrease in blood pressure and management of hypertension. Example for these drugs are amlodipine and felodipine. Lastly, I want to show you some guidelines for the management of hypertension. These guidelines are according to the ASH, which there are several guidelines which are prescribed by several organizations. In these guidelines, they have seen the management of blood pressure according to the age of patient, how we can first modify the lifestyle, then we can start with drug therapy, not for normal stage 1 hypertension, stage 2 hypertension, or other special cases. What do we need to do? If we need to add combination therapy, single therapy, or any other. They have given calcium channel blockers, thiazide diuretics, or beta blockers. Angiotensin converting enzyme inhibitors are also given according to the need of the patient and the stage of the hypertension. They have given if it is between 90 to 96, it is above 140, or in special cases. Special cases are if there is kidney disease, diabetes, coronary artery disease, heart failure, then what? So there are several methods for the management of hypertension, but at last I would recommend that if we uh, modify our lifestyle from beginning only and do the regular checkup with the doctor, then we can easily overcome with this condition. There is no need to take the pharmacological drug therapy. Thank you.